45 years since I graduated from medicine.
For more than 4 decades, Dr. Sergio Aguilar Gaxiola has focused on serving disadvantaged communities.
What drives me, by the most part, is passion and commitment.
That passion started at an early age.
Quite frankly, it goes back to a calling that I have had since I was a teenager, and even perhaps a kid.
Aguilar Gaxiola grew up in Guamuchil, a small city in the Mexican state of Sinaloa. He lived there until age 14, and then moved to Guadalajara, Jalisco, where he finished high school, pre-med, and ultimately graduated from UAG School of Medicine in 1975. Aguilar Gaxiola's desire to become a researcher led him to the U.S. in 1981, where he eventually obtained a master's and PhD in clinical community psychology at Vanderbilt University. In 1987, the Mexican government offered Aguilar Gaxiola a scholarship, so he returned to his native Mexico until 1990, when he was recruited to come back to the U.S. Aguilar Gaxiola worked as a professor at Fresno State until 2005, when he was recruited by UC Davis. It was then that he founded the Center for Reducing Health Disparities, which has been operating for 18 years.
Navigating the health systems is very challenging, especially for those who don't speak English.
That's why Aguilar Gaxiola is so passionate about reducing health disparities by researching and addressing the issue through community engagement and what he calls the 6 A's of healthcare: availability, accessibility, affordability, appropriateness, advocacy, and accountability.
We need to really provide evidence that it is possible to advance health equity, especially on historically underserved populations like Latinos.
It's through this center that Aguilar Gaxiola and its team continue helping increase access and quality of care, transforming the way underserved communities get medical and mental health services.
We go to where they are. We go to their places of work. You know, if they are farm workers, we go to where they work or where they live.
Under his direction, the center led the effort to make COVID-19 rapid tests and vaccines available to thousands of farm workers and other essential workers throughout the pandemic.
Who would have known, you know, that this kid from Guamuchil, Sinaloa, you know, who went to public schools, certainly elementary and secondary schools, would be in a position, you know, in which we are serving immigrant populations, underserved populations.
In September 2020, Aguilar Gaxiola received the Otli Award, the highest honor granted by the Mexican government to individuals who dedicated their lives to improving the well-being of Mexicans, Mexican Americans, and other Latinos abroad. And earlier this year, Governor Gavin Newsom named Aguilar Gaxiola to the Governor's Advisory Council on Physical Fitness and Mental Well-being for his expertise in mental health. More than 40 years into his profession, Aguilar Gaxiola isn't planning on slowing down. He's now focused on facilitating a paradigmatic shift in providing health services to underserved populations, bringing telehealth and telemental health services directly to them.
They say, if we are going to receive services through the phone or through, you know, the smartphone, FaceTime, if I don't have to travel an hour and a half to get services, and I can do it where I'm at right now, it's most welcome.
Doing all this while teaching the next generation of students as a professor of clinical internal medicine at UC Davis. Aguilar Gaxiola's passion still radiating as he shares his goals for the road ahead while looking back on the journey.
It's not so much how much I can inspire, you know, others. It is how much I have been inspired through all these years. When I reflect, I feel that I have been incredibly blessed.
This small-town kid from Guamuchil, Sinaloa, leaving a mark on thousands in our community, driven by his commitment to make a change. In Sacramento, Monica de Anda, Fox 40 News.